Okay, so good evening, my dear students. I hope you had a great day today with the NEET PG exams. Yes, and I hope all of you could rock all the questions. And here we come to the end of the discussion, probably where we would be looking into the questions related to PSM. So in PSM, I have roughly got around 20 questions recall. And if you ask me, out of 20, you should be able to score some 18 or 19. Okay. The very basic reason was there was only one question, yes, which you asked me if as of now, that is the Colombo plan. That was one thing probably which was new, which even I didn't know because I had never read it in my PSM as a UG or as PSM as a PG as well, because it's a very old thing. Yes. Okay. Looks fine. Okay. Now just a second, guys. Let me just set up the camera once. Okay. Okay. So I hope now it's better. Yes, guys. Okay. Now let us look into the different questions which had come. Remember again, this is purely a question recall by you guys. So there might be slight difference in the question. If there is, please let us know. Okay. Okay. Now, epidemiology. The first question which had come. A study among two groups of people working in aniline dye factory for 20 years was conducted. Study with people working in factories and office workers of the same factory, and they saw the documents. Now, the interesting thing over here is, did they mention this? Saw the documents? Yes, guys. Did they mention this? Saw the documents? Because if they are talking about saw the documents, then my answer will be different. And if they were asking about exposure, my answer will be different. Okay. So if they were asking about exposure, my answer would be a case control study. Whereas if they were asking about seeing the documents, my answer will be different. Yes. If it was seeing the documents, then definitely my answer would be retrospective cohort. Would be retrospective cohort. Okay, guys. I hope everyone is clear with this. Yes. Just a second, guys. No. Okay. So coming back now again. Okay. Okay. Now, if guys, if they had given you about documents, my answer would have been retrospective cohort. If they had mentioned ask about exposure, yes, then my answer would have been a case control study. Yes. Comparison between exposed and non-exposed, if they would have given, then definitely my answer would have been cohort. Definitely my answer would have been cohort. Okay, Ankit? If they would have mentioned comparison between exposed and non-exposed, yes, because comparison of a exposure and non-exposure is a classical feature of a cohort, And since they were talking about looking into documents, my answer became retrospective cohort. I hope I'm clear with this, guys. No problem. Okay. Infectious disease. Next set of questions. Yes, just a second, guys. Okay. Second question was a repeat question. Clean cut wound in a male with a TT received 10 years ago. What should be the management of the wound? This was actually NEET 2020 question. Now it is a clean cut wound. So if you look into this, we had discussed this in the PYQ session also. If it is a clean cut wound and the person history was the most recent dose within past 10 years. So the cutoff is less than 10 and more than 10. Yes, less than 10 and more than 10. If it is more than 10, then the answer would have been yes, then the vaccine is not needed today. If it is that no, then it should be vaccine is needed. So I hope I'm clear with this. Yes, so clean cut wound over here, the person is having a clean cut wound received 10 years ago. What should be the management? Now the cutoff was 10 years, and that is where the answer will come as a single dose TT. Okay, guys? Okay. A 10-year-old boy presents with rash, Koplik spots, and ear discharge. What is the diagnosis? January 23 question, recent question of FMG. The answer was measles. Yes, no doubt in it. Very simple question. Yes, okay. A child in a class 5 in urban school will receive which vaccine under school health service? Yes, again a NEET 2021 question. The answer would be TD, because at 10 and 16 years we give TD. Preksha, no chance of immunoglobulin at all. That is absolutely wrong. No immunoglobulin. Okay. Okay. A patient has varicella. The management for remaining contacts. Now this was a confusion. Some students sent me that they had asked about case. Some students told that it is about contacts. Can anyone clarify? Was it case or a contact? Now if it is a contact, then in that case we need to isolate for 14 days and give varicella zoster immunoglobulin within 48 hours. Yes, within 48 hours. Actually it is 48 to 72 hours. Yes, 42 to 72 hours. Okay, now different versions coming. Some are saying contact, some are saying case. Okay, now if it would have been a case, yes, management of a varicella case. For management of a varicella case, definitely we have to give acyclovir. There is no doubt with it. Yes, then the answer will be acyclovir. But again, the person has to be isolated for 14 days. Yes, 14 days. And immunoglobulin has to be given within 72 hours, or it can be 96 hours. Okay, still it boils out to a similar answer. Okay, I take it as hostel boys. No problem. Yes, case or control. I hope the idea is clear. To all of you. Yes, guys. Okay. A classical triad of congenital rubella. A NEET PYQ question was given. Yes, cataract, cardiac anomalies, deafness, and in this it was given as PDA. Okay, PDA. Yes, I hope I'm clear with this. No doubt. Okay. A wife of a truck driver, female, presented with. Now again a controversial question. Some students told me it was only vaginal discharge. Then the answer will be kit 2. If it is only cervical discharge, then the answer will be kit 1. If it is both vaginal and cervical discharge, answer will be kit 6, because then it is PID, ascending infection. So I have given answers to 3 different versions of the question. Now it depends upon which version was asked. You guys can have a clear idea on it. Yes. Yes, done. Okay, definitely vaginal discharge with cervical erosion. Okay, that's what I've written. Discharge or erosion, then the answer would be kit 6. then the answer would be kit 6. Yes guys, no doubt in it. Okay. One more question was there on STD. One more question was there on STD. Can anyone tell me what was the question? One more question on STD. Shubhangi, again try to understand. It varies from it varies from your question to question. It is both single, double, it varies a lot. Yes, Ankit, please don't look into the question. That's the reason I have given you all the 3 versions of the question. Yes, if it was only vaginal discharge, it will be kit 2. If it is cervical discharge, it will be kit 1. If it is both, it will be kit 6. It varies from question to question, how we frame the question. Okay, so don't worry, there will be a confusion in it. Okay, trichomonas vaginalis, question with micro, I am not getting into it. I am not getting into it. Yes, I am not getting into it. Okay, 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 looks fine. Okay, now non-communicable disease. One of the student, only one student has recalled this question. Person with low hypertension in childhood tend to have low BP in adulthood. What is the phenomenon? This is called as tracking phenomenon. Was there this question? Was there this question? Yes. So answer was tracking phenomenon. A very simple NEET PYQ question. A very simple NEET PYQ question. No doubt. Can anyone recall me what were the other options? What were the other options? What were the other options? Yes. Okay. Now, health programs. There was a question. Patient is having sputum smear negative and X-ray is positive. Under NTEP, what is the next step in management? Now, the first important thing. Okay, so students are recalling. One option was rule of halves. Yes. The other option was stepwise approach. Yes. Class screen for hypertension. Okay, fine. This question. Sputum smear negative, X-ray is positive. Under NTEP, what is the next step of management? We will repeat the sputum smear. This is the best answer. Now, if this is not available, then my second answer would have been do a CBNAT. So, yes, so this would have been the first choice answer. This would have been the second choice answer. Yes, this would have been a second choice answer. Okay, someone is saying sputum culture. Absolutely not. Somebody was saying sputum culture. Absolutely not. Yes, or liquid culture. No, we are not going to do all that. We are just going to repeat the sputum smear. We are just going to repeat the sputum smear. Yes, guys, looks fine. Looks fine. Yes. Okay. Okay, some are saying LPA. Okay. So I have told you the answer. The best answer would be repeat. If not, then do a CBNAT. Okay. A 7-week pregnant female came to PHC having hemoglobin 9% when iron tablet is started. Yes. Was there a question? Yes. Was there this a question? Yes. Was there this a question? Now, if she is hemoglobin with 9%, she is anemic. You are not going to wait for a second trimester. At a PHC level, we do not wait for a second trimester. We start the IFA as soon as possible. We start the IFA as soon as possible. Okay. So we would go for 8 to 10 week. We will start the IFA at 8 to 10 week. Yes. 8 to 10 week. Okay. Some are saying 10 to 12 weeks. Some are saying 14 weeks. Some are saying, okay. No, Kalpana, not come in second trimester. No. She is already pregnant and she is anemic. You have to give her. You have to give her. Yes. Okay. This was not there. Agree. Yes. I hope it's fine. I hope it is fine. Okay. Yes. Okay. Next question. Nutrition. Bhar ke questions. Now, this question. A poor farmer with a history of successive crop failure develops progressive spastic paraparesis, upper motor neuron signs and gait instability. Most likely toxin is BOA, neurolathyrism. Neurolathyrism. Yes, guys, neurolathyrism. No doubt in this. Similar question. Again, I repeat. Dementia, dermatitis, diarrhea, death, deficiency of niacin. Again, a NEET PYQ. Again, a NEET PYQ. Yes. Okay. 97.5% able to cover nutritional requirement. RDA. 97.5% is RDA, 50% is EAR, 50% is EAR. Yes, guys? Okay. Raw egg deficiency. There was some question that person is taking raw egg. There will be biotin deficiency. There will be biotin deficiency. Yes, the raw contains avidin which impairs the absorption of biotin. Due to that, we are cooking the egg. We are cooking the egg. This destroys the avidin. This destroys the avidin. Yes, guys, I hope I'm clear with this. No doubt. Okay. Okay. Image of what, Kalpana? You can let me know. Image of what? Yes. Okay. There was probably one more question where there was treatment of neurolathyrism. Yes, we give vitamin C, that is the vitamin. We ban a crop, health education, parboiling, steeping method, genetic approach, socioeconomic development. So there were two questions probably on on neurolathyrism. Two questions on neurolathyrism. Yes, two questions on neurolathyrism. Yes. Okay. Alcohol with vitamin deficiency. We know which vitamin? Anyone? Anyone? Alcohol with vitamin deficiency? Thiamine. Thiamine. I also came to know there was a question on vitamin B12 deficiency, C deficiency. Was it there? Was it there? Was it there? Guys, have patience. Let us look into the questions I'm discussing, because home visit question, all that I have put it. So don't worry. Yes, don't worry. Have patience. Yes, okay. Water testing method. Some question. Technique correct for tap water collection. Let it run for 1 minute. Streamline flow so splash doesn't occur. Stuck bottle tightly to avoid a splash. Touch bottle mouth to tap. Yes. How to do water bacterial examination? Let the water run first for 1 minute, then collect gently. Collect water without splash. This makes the best option. Okay. So anyone can tell me? Anyone can tell me what was the question? Yes, water testing question. Anyone can tell me? Yes. Yes, guys. Anyone can tell me? Yes. Okay. Okay. Yes. The rule says you allow to run it for 1 meter and then we collect the sample. That is definitely there. Yes. Yes. That is definitely there. You have to let it run for the first 1 minute and then only collect. And then only collect. Okay. Okay. Last option divided into 2. Fine. Looks fine. No problem. Yes, guys. Okay. Okay. Now, similarly, I got one more similar version. Yes. Before taking the sample, let the water flow for 1 minute. True. Take sample from gentle stream of water to avoid splash. No. Yes. Keep the bottle near tap to avoid splash. Take sample from water tap which is leaking. No, we do not take it from what leaking. Yes. So the best answer would have been option number A. Option number A. Okay. So I have put both the versions of the question. Whichever you guys let me know. Yes. I hope it's okay. Okay. Occupational health. Aniline dyes, which cancer? Aniline dyes causes bladder cancer, transitional cell carcinoma. Again a PYQ, million times this question has come. Yes. In Robbins also you must have been taught. Yes. Okay. Cement industry worker, X-ray changes, mesothelioma given. If the question at mesothelioma, no doubt the answer will be asbestosis. No doubt the answer will be asbestosis. Yes, guys. No doubt the answer will be asbestosis. Okay. Now, white finger, vibration. White finger, vibration. This is common with dentists and orthopedicians. Yes, dentists and orthopedicians. Raynaud's phenomenon. It is Raynaud's phenomenon. Basically, it happens also in carpenters, which was there for your drilling. Which was there for drilling. Okay. Okay. Bladder cancer wasn't there. Can anyone tell me any other option to it? No problem. Okay. Healthcare of community. Okay. Aniline question was not there. Okay. I am putting a cross. I am putting a cross. No problem. Chill. Okay. 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 Healthcare of community. What is the best parameter for accessing the health status of community, or best predictor of government failure, or sensitive indicator of availability of utilization of health services? Answer was IMR. Again a PYQ question. Again a PYQ question. Yes. 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 No doubt in it. No doubt in it? Yes? Okay. Now, 30-week pregnant female is not eating papaya. Who will counsel her? Visit at home. Now, please mark, if it is mentioned visit at home, the answer over here will be Asha worker. But if it is not written visit at home, if not home visit, then my answer will be Anganwadi worker under the ICDS program at Anganwadi. Yes, it is Anganwadi. Yes, so please have a look. If the word home was mentioned, it will be Asha worker. It will be Asha worker. We do not have home visits by Anganwadi worker. We do not have home visits by Anganwadi worker. Please be very clear. Yes, if anyone says that answer is Anganwadi worker, answer is wrong. Anganwadi worker does not make home visits. Does not make home visits. Yes. Okay. Miscellaneous question. What is Colombo plan? Cobalt therapy or cobalt supply. What is it? 1950. Economic development, industrial development, agriculture development, health promotion, setting up of AIIMS, cobalt therapy units were established. Yes, finished. So these were the questions which have been recalled. I have tried to compile all the recalls which you guys could tell me. Again, they are recalls. There will be some confusion. Yes, there can be some confusion. So please do not worry. If you have any other questions, you can just drop me a message on WhatsApp at this number so that I can rectify it and I can give you a proper discussion video. Yes, I can give you a proper discussion video. Okay, YLL question is there. Okay, YLL question is there. Okay, YLL, I get that. I will add a YLL question. Yes. So if you ask me guys, there were roughly 20 questions, and in PSM hardly you had the Colombo plan which was new, otherwise the rest all were old. So at least you score 18 out of 20. Yes, 18 out of 20. Is it okay guys? No problem. Should I stop over here? This, my dear students, is the last session for today. Thank you for giving your valuable time. I hope you guys have rocked the show. There will be some questions which are dicey. They always are. Trust me, it is always plus or minus 5% because that is what is the concept of p-value, 0.05. So please do not panic with different teachers giving different answer. Please try to understand there will be 0.05 p-value, that is by chance, but 95% if you have prepared well and you have given the exam well, you are going to crack the exam. I hope everyone is clear by this. Yes guys. Okay, see you. Bye bye. Thank you. Yes guys. Okay.